I want to thank Dr. Polsky and really everyone here who spent so much time planning this workshop. John Auerbach, from the moment I was nominated way back when, we started having discussions, really planning and laying the ground for this workshop and this whole body of transformative policy. I also see Karen DeSalvo, the former ASH, we're known as ASH's, Assistant Secretary for Health, here. So I think it's also good to have an ASH from the current administration and ASH from the former administration, showing that this is really a not political topic, but a topic that we all have to get behind for public health. So I'm extremely pleased to be here. I also want to say that I wanted to have this workshop probably, I've been in office about 14 months. I thought I would have it like 3 months into it, but I think in retrospect, this is the exact perfect time to have this workshop because so many forces are coming together to make this not just a pipe dream anymore, but a potential reality that's transforming into reality pretty quickly. I start with this in multiple forms. I'm a pediatric critical care physician by training. I spent most of my life spending enormous amounts of money working on the last few inches of a person's life when so many things could have been prevented beforehand. We're still having the same discussions again with vaccinations, measles, pertussis, child safety, all the discussions that led to most people in my unit. So I sort of approach this from that clinician standpoint, sort of an intensivist turned into a public health advocate. We all know that we spend a lot of money in this country on, quote, healthcare, going up to $6 trillion by 2027 by our projections. But as we all know, the outcomes that we have in this country are pretty poor compared to other countries. Whatever you want to pick, 28th in life expectancy, 33rd in infant mortality, 30th in suicide rate. Again, I'm also the lead for opioid policy within the department, and I'm running the HIV initiative. All of this is really social determinants wrapped up in many, many big packages. And in 2015 and 2017, as you know, life expectancy decreased for people in the United States, which is really shocking to me as a new grandfather. My granddaughter has the real prospect of living a shorter and less quality life than her grandparents or parents, and I don't think we can accept that in any way, shape, or form. Well, everybody knows this, everybody in this room knows this, but I always like to ingrain it. We put a lot of money into the system, focusing on clinical care, which is certainly important, but as we all know from the Robert Wood Johnson framework, access to medical care is about 10% of your health outcomes. And by the way, you can have all these slides, right? So I don't know the mechanism to do it, but all of these are for you to go with. And 10% for quality of care, but there's so many other factors. As you know, the social and economic factors, the physical environment, health behaviors of which we invest relatively little into. And the answer is pretty simple. If we want better outcomes, we have to invest in the parts of the entire public health system that are really going to make a difference. Now, I also have another hat that I wear. I'm the nominee for the executive board to the World Health Organization for the US. So I get to go places and do things. And I was incredibly impressed by this. And I know many of you have probably been to Kazakhstan, right? So I was in Kazakhstan in October for a World Health meeting on primary care and the importance of primary care. And I visited some of their, quote, polyclinics, where a really nice sort of community health center, but extended, that has birthing areas and minor surgery and everything there. So instead of a Red Cross, this is what they have on every one of their clinics. And I was shocked at how important this is, because they want everybody to know that the red part, that's what we can do for you. That's what we can do at the polyclinic just by medical care. The rest of your health, yellow, health behavior, genetics, environment, and those are very, very important aspects. And the moment you come in, that's there right when you register. It's plastered on every wall to really emphasize, I think, a lot better than we do, what people can expect of medicine, formal interventional medicine, and what they should expect from other factors in their life. I thought that was a nice thing, and I show it all over. We certainly know, and I celebrate all our cancer cures, immunotherapy, $700,000, $1 million a dose CAR T therapies, but we relatively less talk about things like 42% of all cancers in the United States could be prevented. I want to cure cancer, but I'd sure rather prevent those 42%. That at least half of our 700,000 deaths due to heart disease can be prevented just by relatively simple dietary changes. We don't need to turn into nutrition gurus, be able to do 500 push-ups and run a marathon. Relatively simple dietary changes move us down that road. ODPHP, the Offices of Disease Prevention and Health Promotion, Carter Blakely is here, who's the deputy director. I had the great privilege, part of it being the ASH. Sometimes I got to do a lot of work and get no credit, but a lot of times everybody else does the work and I get the credit. So they spent a couple years working on the physical activity guidelines for American, the updates that I got to kick off at the American Heart Association. But it's clear that if we only did 150 minutes per week of moderate activity and everybody did this, we would save $117 billion in annual health care costs and save 10% of all premature mortality just by those simple steps. Yes, I'm a molecular biologist too. I got really shocked to know that except for very specific circumstances, our zip code still matters more than our genetic code. And again, you probably read this article, all wrapped up in the social determinants of health. I will say at a different time, we are starting a new initiative within my office in the Commission Corps called Operation Change the Map. My principal deputy, Rear Admiral Sylvia Trent Adams, who previously ran Riot White at HRSA, was previously the Deputy Surgeon General. I've been complaining since day one, and I told my Deputy Secretary, I showed the Deputy Secretary, I said, see this map? What do you want to tell me about it? He said, I will tell you one thing about it. It's the same map I saw 10 years ago, 20 years ago, and 30 years ago. So we're going to make a real affirmative decision to change the map. And finally, as a pediatrician, of all simple graphs, sometimes the simplest of graphs frighten you the most. When you look at projections, this was an article published in the New England Journal, I think in 2017, maybe in 2018. I have the site there in 2017. The projections are that today's 2-year-olds, by the time they are 35, 60% will be clinically obese. If we don't intervene in this kind of trajectory, we're done. Our healthcare system will break the bank. We already have 3/4 of our 18 to 24-year-olds who cannot qualify for military service if they tried because of obesity, fitness, education, or drug use. This is a major problem that we all have to face and all have to face together. Since I get to geek out with this audience, and I can't do this very much, I think we're at a unique time for a couple reasons. Number one, because of biological reasons, talking about the social determinants of health, and also because of the policy options that we have facing us. So I'm going to talk a little bit about the biology. And this was sort of a manifestation to me because I hadn't really worked on this a whole lot before my 9 months of incubation ready to get confirmed. But I think we have an opportunity to tell the public that social determinants are not just some fuzzy concept with tree huggers running around that we need to do better for everybody, but social determinants have long-lasting biological consequences that we're just learning about what they are and how they translate long-term. And I think all of you know this, but I want you to know where my head is when I approach this. I start with some that are pretty obvious. I'm a Peter Hotez fan, a pediatric infectious disease doctor, founder of the National School of Tropical Health, and a mover and shaker in terms of neglected tropical diseases, the diseases of the 1 billion poorest humans on the planet. And when we think of Zika, we think of it as a medical condition, but it is a condition of poverty. Make no question about it. It's a condition of cramped living quarters, of poor sanitation, with water in tires, trash. It is clearly a disease of poverty and social determinants. And when you're born with microcephaly, what does that affect to that child, their family, their entire family structure, sometimes their community? Shocking to me, and I don't know if you saw this study in 2017, but hookworm is the prototype of infectious poverty that Peter talks about, that really you can tell a nation's economic development just by their worm load. If you have hookworm, you have chronic anemia, you don't develop, and you have cognitive delay, and it lasts long-term with your economic outlook, your education, and your employment. 35% of households in 2 counties in Alabama were infected with hookworm. 35%. That's Alabama in the United States because they don't have sanitation. Tell me where the investment should be for those children who are going to have a lifelong of infectious poverty. I won't go into this, but this is another aspect how it has biological complications. We all know about the 3 million word gap. If you don't read to your children, if you don't talk to your children because you cannot do so, you don't have an education, or you're out working or working 3 jobs, that critical component of language development is never developed, and it tracks long term. If we really want people to have good health, they need education, employment, and income. If they can't get educated, they can't get employment and income, and if they don't have those critical needs met when they're early childhood. They will, of course, they're not predestined to not make it, but it certainly puts the vector in the wrong way. And then finally, there was a plethora of literature, certainly in the 2012 to 2016 era, but not so much anymore. And I'm wondering if this is still a very important topic or whether it's sort of faded away. I think we all know that epigenetics really is a really key biological concept that I've been very successful in explaining to people, that social determinants, that adverse childhood experiences leave an epigenetic mark. It's not all about your genes, it's about how they're transcribed and translated. And these epigenetic marks can last a very, very long period of time and are correlated even multiple decades down. So when I'm thinking about this, I'm not only thinking about doing something from a policy framework, but how do we also explain it to people who are both scientists and non-scientists, and to show that we actually have a biological mechanism about how social determinants affect not only in the short term, but over the long term, I at least personally feel is a very, very powerful concept and one we need to exploit in the positive way. These are 9 words that everybody in my office knows because it's the first thing I ask them to know, and I just see Captain Felicia Collins walk in, who's our Deputy Assistant Secretary for Minority Affairs, for Minority Health, Director of the Office of Minority Health. She is a Harvard-trained pediatrician, MPH, of course, went to Children's Boston. We like pediatricians, so I'm recruiting a lot of them, but get to know her if you don't. So of course, Health for All, something that we all understand, that everyone has a fair and realistic opportunity. Health by All, very important that we distribute and democratize healthcare knowledge, capabilities, and delivery, and we do a lot about that. And finally, prioritize health considerations in all sectors and policy areas. And my mind was all about the social determinants of health, including infrastructure programs and everything that the government may do, just so you know where our head is. Healthy People 2020, now Healthy People 2030, which is being developed, characterized and put as goals many aspects of social determinants of health. The new rollout with it's publicly announced, right? You rolled out the public comment version. So pretty soon we'll have the final version in the next couple months of the main goals for Healthy People. And Carter did the most amazing thing that I've ever seen, and that is reduce the goals from 1,200 down to below 400, I'll just say, right? That's very important. It's hard to execute against 1,200. It's very hard to execute against below 400, but it's something that we can track. But again, we understand that the social determinants of health are very important, and they're going to be objectives for the nation in Healthy People 2030 as well. I think we have now let's shift to policy. I think we're in an absolutely unique moment in that we have a secretary who has 4 major priorities. 3 of them are actually, as he says, the ships are launched, and the 4th one, which is the most complex one, is really just getting underway, and that's why this is the most important time, and that is value-based care, transforming our system from one that pays for services to one that pays for value and pays for health. I can only tell you that the secretary, as we say sometimes in Texas, is as serious as a heart attack about this. I mean, he really is, that he does not want to nibble around the edges. He does not want to make an impact in small sectors. He wants to do this in a big way. But transforming the U.S. healthcare system, as fragmented as it is and is dependent on reimbursement strategies that are counter often to public health, is a big, big, heavy lift. And this is why this workshop is so important, to build some of the theoretical and academic and knowledge basis for some of the pieces that have to come into the value-based agenda. I cannot explain how important this is. I talk with the secretary every single day that this is on his mind, and it is something that will be taken very seriously as a result of this workshop. This was announced this week, and I hope you saw that, just to give you an idea about how serious the secretary and CMS, Seema Verma, Adam Bowler, one of the other 3 senior advisors to the secretary. This was an announcement of an alternate reimbursement model that will affect 11 million Medicare fee-for-service recipients, about 25% of primary care practitioners, and potentially 11 to 12 dually eligible Medicare and Medicaid. That really is a value-based reimbursement system that focuses on preventing disease before it occurs and progresses. This is, I think, earth-shaking in its importance. If you've seen what lots of people read, but I'll read one from Andy Slavitt, who is no stranger to anyone. His quote was, "There are several watershed moments in the history of the Medicare program, like the coverage of prescription drugs and the shift of paying for better care. The approach announced by CMS today is another one, as it eases the connection of Medicare beneficiaries to primary care physicians and give doctors the freedom, rewards, and tools to keep people healthy." If we don't have a policy permission to really focus on social determinants of health, I don't know what it is, because this is really defining and freeing the system to focus on health, and as we know, health is 80%, not just access to health care, but everything else. So I'm extremely excited. And we know that the private sector is moving in this direction as well. You could pick any headlines you want to. This is one from this week about Humana, looking at a couple aspects that are very important, and very important to Dr. Don Wright, the director of ODPHP, screening for loneliness in elderly individuals, as well as food insecurity. And they have 500,000 seniors on this program, and they've shown in many communities, they've decreased, like San Antonio, decreased unhealthy days by 10% over a 4-year period. That's an enormous change, even as people grow older and stresses get worse, to reduce unhealthy days by that. So here we are, and there are a few minutes for questions. The first 3 is what you heard, and those are the tasks, so I will immediately do something that I probably shouldn't do, is add to those tasks, or at least put those tasks in my words. So the tasks are important, and they're critically the foundation. But what I'm really interested in as sort of subtasks to that are there specific recommendations on how, where, and when to demonstrate effectiveness of investments into the social determinants of health? We're all on the same team here. I've said this before. Our positions will change a lot. In a few years, it may be 18 months, it may be 5.5 years, but I'm going to be in the audience. One of you may be up here. But while we have the reins to potentially make large changes, if there are specific things that we can do, I want to know about them. And I will take it as my responsibility as your government servant to make it happen. Second, how do we create a universal business case, and to whom, when the benefits of investing may be far removed from the impact on health and financial savings? This bothers me a lot. Whether we're talking about treating people for HCV, that has a large upfront cost but a great societal savings, or whether it's screening people for HIV or providing them PrEP, often the benefits of that are dissociated from the people making the investment. So how do we really create the business case, and to whom, given that some of the social determinants of health will take a much longer time for people to reap the investments? I think these are just critical questions that I don't know the answers to. I know some of the answers to, but that's why the best minds in this country are here, not just with minds, but with a lot of passion to address these questions. And my job is to let you know that your work will not just be published in a paper, but are going to go right to the policy discussions to see if we can make something happen positive. So with that, I greatly appreciate your time, your work, your travel. I know people have traveled a long way to get here on a relatively early start, and I'd be happy to answer any questions. Thank you.